Hi everyone, welcome to the webinar this evening. I'm Valanda Calloway and I'll be your host tonight. I'm excited to speak with Matt Eirich, the CEO of Alo, and Dr. Paul Hain, Alo's Chief Medical Officer. We're going to talk about clinically integrated networks, CINs for short, and how they can help independent practices. Don't worry about taking notes. All attendees will be sent a recording of the webinar later in the week. And if you have any questions, be sure to click the Q&A tab right below your video stream. We'll try our best to get those questions answered later in the webinar. If we don't get to yours, I'll make sure someone from Alo follows up via email. Okay, let's get to it. Matt, I'll ask you the first question. Who is Alo and what is your company's mission?
Hi, thanks, Valanda. It's great to be here. Alo's mission is to support independent physicians, their practices, and the patients that they care for. In our definition, an independent physician is one that operates his or her own practice as opposed to working for a larger organization like a hospital-sponsored medical group. And over the last several decades, the number of independent practices has dwindled in most markets, including in North Carolina. In the state currently, over half of physicians are employed by a hospital system, and in some markets, it's close to 90%. And that's because the business of medicine, running an independent practice, has become increasingly difficult, more expensive, more complex, with more demands on practice owners and their staff. It's just hard to be a single practice and make it today. And that's really consequential because the loss of that option as a practice environment for providers and as a care destination for patients means that in many instances we get outcomes that aren't as good as we would like them to be. It means that oftentimes costs go up. It means that patients sometimes lose access. And oftentimes both patients and physicians feel as though the very important relationship between patient and provider is somehow diminished and stretched. So we here at Alo exist to try and remedy that, to bring solutions and support to those independent practices so that they are able to retain what animates them and what they love about medicine, which is caring for patients and being in the clinical workflow, while also being able to hand off a lot of the administrative burden of healthcare to a party like Alo that can do it on their behalf.
That sounds like a great mission and a noble cause. So can you tell me what has Alo done over the past year and a half to help independent providers?
Yeah, it sure feels like we've been busy in the first 18 months, and we've been focusing on a few areas where we really feel like we could have an impact and really live our mission. One of the first moves that we made was to join forces with Advance Care, which is a network of primarily primary care family medicine practices in Raleigh and Charlotte in order to help them to continue to grow. We're very proud of our partnership with Advance. It is a tremendous organization. Advance operates over 30 locations that are mostly staffed by owner-operators, so independent physicians who retain autonomy over key elements of their practice, such as clinical decision-making and how they staff their practice. In addition, Advance offers a vast array of integrated wraparound services that helps to enhance patient care and patient access, things like behavioral health, psychiatry, nutrition, and care management. In addition, we've partnered with select health insurance or payer partners in order to help their members navigate to care settings like Advance Care more easily when they have clinical needs. And then finally, just recently, we announced the launch of the Alo Clinically Integrated Network. The Clinically Integrated Network will allow independent physicians to realize their strength in numbers by collaborating on improving quality and the efficiency of care and being better rewarded for it. We're really excited about this new option in our solutions portfolio and what it could mean for the ability of independent practices to continue to thrive.
Wow, that's a lot. Dr. Hain, for those attendees who aren't as familiar with clinically integrated networks, can you give us an overview of what a CIN is?
Absolutely. A clinically integrated network is a group of providers who come together to share best practices and data and evidence-based guidelines to make sure that the quality they're providing is at the utmost and that the value they provide is reflected in that care. So they're able to share data, have guidelines, and improve value. And this is a win-win for everybody involved. So you have patients who are able to have increased access and better quality. You have providers who are able to access data platforms, able to improve their quality to their patients, and are able to come together and approach payers in a way that allows them to contract for that value that they're providing. And of course, the payers get improved quality. They get patients who are actually able to be better managed, and they see a right sizing of utilization for their lives that are covered under their policies. So really, a clinically integrated network is something that works well for everybody.
Interesting. And I already see a few questions coming in. That is great. We will get to those shortly. Dr. Hain, since our audience tonight is mostly physicians, I'd like to dig in a little bit deeper on how providers benefit from being a part of a CIN.
Well, certainly there's the part that is baked into being a clinically integrated network, which is improved value, improved quality, the ability to see data flowing back and forth, both about your patients and about other evidence-based guidelines. But if you're an independent doctor, if I'm an independent doctor, say, I don't want to be walking in and trying to talk to payers by myself because it's so hard to prove that I'm a valuable member of a network. Now, there's strength in numbers. So if you can come together and form a clinically integrated network that is able to show value across that network, then you can actually approach those payers and have a conversation about that, while at the same time not giving up your autonomy and not being tethered to a specific health system. So we see a lot of clinically integrated networks in the world out there who are focused around the hospital. We like it better if you're focused just on the patients and just on the primary care and making sure that folks get to where they really need to be.
And when you say support infrastructure and benefits, what exactly do you mean?
It's important to know. So support really means that you're going to have resources and services such as IT support, those clinical guidelines we were talking about earlier, and education both for your practice and for your patients. The data infrastructure is really important, and that's a technology that's going to help support that flow back and forth of the data about your patients and making sure you know how you're doing. And then, of course, the benefits are benefits of scale, which we've already discussed, that strength in numbers are important when you're talking to payers and when you're actually aggregating these patients to say, hey, how are we doing on a macro level? This is something that can actually occur.
Okay, and what clinical benefits will providers see?
Well, the clinical benefits are fantastic, right? Because you end up being able to track your patient's continuity across all sorts of areas and across all sorts of outcomes. So you're going to see increased continuity of care, improved quality for those patients, enhanced guideline adherence, so there's more of a standardization of care across different practices, and of course, access to population health tools that help you actually manage all of this.
That all sounds great. If it's that good of a solution, though, why aren't there more CINs and why aren't more physicians participating in them?
That's a great question. Now, the reality is clinically integrated networks have been around for quite a while, but as I said before, they're usually associated with a specific health system. So if you're associated with a specific health system, often you are limited by where you can send patients or how you practice. We're structuring our clinically integrated network somewhat differently in that folks who participate in our CIN will have a real voice to help create how the CIN is structured, where their patients are seen, and what kind of quality providers are in the network. We think it's really important that it's a physician-governed organization and that it's run by folks who live and work here in North Carolina who are allowed to choose where they think their patients should go to get the best possible care.
So what does someone have to do to join a CIN? Can you tell me about the requirements and what a practice would have to do differently?
Absolutely. So early on, first you have to meet the kind of the bar to get in, which is really related to providing safe and high quality care. You have to engage in the clinically integrated network once you're in it, making sure that you are following the clinical guidelines to which all the physicians have agreed and designed. And then you have to integrate with the technology solutions, right? And sometimes that's pretty painless and the data just flows across, but you have to be sure that you can actually access the data and pass it back and forth so that everybody knows that they're actually doing better by their patients. And really, for some practices, it won't be much. You already are focusing on a lot of clinically integrated guidelines that are following evidence-based medicine, and so it won't be much of a lift. For other practices, there may be some choices to be made on how they practice and some changes that they have to make to exercise some muscles that maybe they haven't used in the past.
Okay, and if folks want to specifically join the Alo CIN, what do they need to know?
Well, you can go to our website, alosolutions.com, and fill out our Contact Us form, and we'll get back to you to set up a private meeting where we can follow up and answer all of your questions in detail. And I do want to ask folks, do it soon. Folks who are early into the clinically integrated network are going to have the largest opportunity to help us decide how we structure it, to have input on the guidelines and the committees. So it's important that if you find this to be an interesting thing to do, that you come and do it soon.
That is exciting. I want to get to some questions now. We have a few here. Here's the first question. I am already in an ACO. How is this different from an ACO?
That's a really interesting question. So an accountable care organization, or an ACO, is something that focuses exclusively on value-based care. So providers in North Carolina at this point should really have two kinds of contracts. One is a contract with a payer that provides you what we call fee-for-service. So every time you see a patient, you do something, you get paid. And then something that is a value-based contract, so that in the aggregate, after you've run all the numbers, there may be a shared savings payment, and there may or may not be a quality bonus. The ACO takes care of that second part, the value-based care quality bonus. For the fee-for-service part, we can demonstrate that we are creating greater value and be rewarded for that on the fee-for-service side. So really, we take care of the fee-for-service contract side, and the ACOs can take care of the value-based care side.
Next question, how is your CIN governed? How much representation will participating independent docs have?
Always important. Our clinically integrated network will, of course, be physician-driven by the folks who live and work here in North Carolina. We're going to have a clinical integration committee that is consisted of our providers, and of course, we'll have a governing body overseeing it that is mostly consisting of representatives from those physicians who are inside of our clinically integrated network.
Will this require an upfront payment or capital contribution?
That's also really important because a lot of independent providers out there don't have a lot of capital to invest in these sorts of things, so we've made sure that we've set it up where there's no capital contribution needed up front. The clinically integrated network itself takes a small administrative fee while it's running just to pay for all of its data and things like that. But the important thing to take home is no upfront capital contribution necessary.
Okay. Do I get to keep my TIN?
So do you get to keep your tax identification number? Yes, you do, because you're still going to need to have all of those legal structures inside of your practice that operate under that tax identification number. So you keep your TIN, and you still keep your ACO contracts, and you contract with us and work with us under the fee-for-service side.
Well, that's all the questions I see for now. Matt and Dr. Hain, this has been so interesting. Thank you so much for sharing your insights.
Absolutely.
Final question from me, what is Alo's next steps?
Yep, so Philanda, we are on track to launch our clinically integrated network July 1st of this year. We think it's really an important option for independent practices to help them and their practices continue to thrive by harnessing their strength in numbers. And we know if that we're able to do that, then we will have a major impact on access, affordability, and ultimately the health of the state of North Carolina, and we can't wait to get to work.
That sounds great. Before we end the webinar, I want to remind our audience to submit any remaining questions into the form below the video player, and I'll make sure Alo responds to you. Or you can visit alosolutions.com and fill out the contact form on the site. Finally, I would like to thank you, our attendees, for joining us tonight, and hope that you all gained a better understanding of how independent practices can benefit from joining a clinically integrated network. It is always a pleasure to have industry experts share their knowledge with us, and we appreciate your time and dedication to improving healthcare for all. That's it for tonight. Stay safe and healthy, everyone. Good night.